I have this, my net diary. So I take pictures of my food and then it'll show me how many calories there is. Thinking granola was good for me. I'm looking at the calories and it was 900 calories. You know how you kind of think an English muffin with cream cheese might be bad?
Yes.
And then you're like, wow, an English muffin with cream cheese is only 250 calories. When you look at these protein bars, half of them are just crap. How do we push the science? Not that uses feces for solution, but that uses microbes in a consortium to help the disease process. What is the root cause of these problems? Why do we have an increase in Crohn's disease? What is the microbiome?
There are trillions of microbes.
Yes, so we should embark on it. Maybe Alzheimer's is not just a brain problem. Maybe Alzheimer's is a gut problem to begin with.
The girl's losing so much weight, Sabine, like nothing's fitting.
Nothing fits her.
She's swimming in her clothes.
Oh my God, you need to get her more clothes.
Exactly.
We need to go shopping. That's awesome. But good for you.
Yeah.
Wow, talk
No
about
Ozempic.
no Ozempic. I know, doing it right. I've been doing it also. I have
You
this
look. I was
little
gonna tell
trick.
you look really good.
I've lost
do
weight,
look
so
great.
I'll tell you
Since
what
our
I've
last
done.
podcast, you've
Yes,
lost weight.
because I saw myself and I'm like, oh, double chin. I need to get rid of it.
It was just a shadow.
So I have this, my net diary.
Okay.
So I take pictures of my food
Yeah.
by AI. So it'll so for example, this cup of tea, it'll take a picture and then it'll show me how many calories there is.
How does it know what's in the cup?
It knows, see?
That's
2
brilliant.
calories. So
What's it
like
called
for
again?
it's called my
My net AI?
net diary.
My net diary.
Yeah.
NET, like net calories.
NET, like net calories.
Were you
yeah.
surprised in the beginning? Were you getting
Oh my
a
God,
higher
so
calorie?
We noticed that 79.2% of you are not subscribed. So if you're not subscribed, what are you doing? Come subscribe. We give you 5 days a week of free weight loss advice. And I mean, come on. It's a pretty cool vibe over here. So I'd love it if you'd come join. We really appreciate all of your support. So please don't forget to subscribe.
I ate granola thinking granola was good for me.
It's not.
No, it was like oatmeal and granola. Mm-hmm. And then next thing you know, I'm looking at the calories and it was 900 calories. And then I realized, 200 of that were the sunflower seeds. Get rid of the sunflower seeds. 200 were the granola. Get rid of the granola. And then at the end, I kind of like, you know how you kind of think an English muffin with cream cheese might be bad?
Yes.
And then you're like, wow, an English muffin with cream cheese is only 250 calories. And what I thought was good oatmeal was 900 calories. Okay, forget that noise. Right?
Yes, but the nutrient density, like, is it an Ezekiel
Yes.
English muffin, and is it like, fermented cream
Yes,
cheese that's
it's
all natural
fermented,
from
yes,
raw milk?
yes.
It's like, so that's like, as we talk about nutrient density, calories matter, right? But the quality of the calories matter, and even more importantly,
Quality of
what you're
matters.
absorbing, right? So it's all for nothing if you're not absorbing it. We are not what we eat; we are what we absorb, and
We are what we absorb, absolutely.
And so this protein conversation is just out of control.
And protein, what kind of protein, right? And when you look at these protein bars, half of them are just crap. Yeah.
And there's,
I mean, so much of it, right? It's almost like there's a whole business that is just coming and manipulating the foods and just using what we know of foods to be good to kind of, I don't know.
manipulate our thinking. But I'm really curious what you think in women's health, especially.
Yes.
Do you think we need 130 grams of macros when it comes to protein from animals?
I don't think so.
I don't think so either.
I don't think so.
And it's more about the nourishing traditions that I'm educated in that leads me to that conclusion. Like, and there's a certain toxicity when you look at people who have cancer and other imbalances.
Yes.
When you take too much protein, it starts to clog the basement membrane of the cell. It starts to toxify the liver. It starts to slow down the endocrine. Those are all my hypotheses. But do you think that that's true?
I think there's some truth to that. I think overdoing it, there's some truth to that. Yeah.
Because absorbable protein, like from sprouted mung beans, or the bioavailability of the protein in eggs, for example, mother's milk, lentils, like the bioavailability isn't something that we talk about that much in the protein
And
conversation.
it's not, and also there's so many people that cannot tolerate the lentils and the chickpeas and all that, right? And I think because probably they've been manipulated.
Oh.
The chickpeas and the lentils are not what we used to eat. Even the grains, the gluten, the gluten bread, the gluten is manipulated.
Absolutely.
Everything. I mean, like you think about corn, right? Corn used to be great. I mean, corn used to be great as far as like, great food, snack, etc. And then it was delicious, but we kind of branded humanity to start eating corn, popcorn, corn oil, etc. And then at the end, it's not that great.
Right.
And especially when they manipulate it.
The glyphosate concentrations on chickpeas, especially, and oats, is some of the
Huge.
highest. So they're like in the top 5. And so I used to think that hummus was a great option, but
No.
actually it's not.
Hummus is the worst. It's on my list of no-nos.
Yeah.
So-
But would you make it from butter beans or fava beans or kind of other types
Fava
of
beans. So if you can find good fava beans, yes, I think fermented fava beans is like a great little secret, especially for Parkinson's patients. It's great little secret. But the problem is finding the right fava beans, that are not modulated.
I have a source for you.
Okay,
and it's
good.
It's like it's stone's throw away.
Oh, yeah. Then give it to me. I think if we can get that source and do fermentation of those fava beans, I think it's got huge potentials.
Which leads us to a really big topic that you know more than anyone in the world on, which is bifidus.
Yeah, Bifidobacteria.
Bifidobacteria.
Yes.
You've made it famous.
Save the Biff. Yes, I've made it famous.
And
But it's so funny because I made it famous and everybody jumps into the whole probiotics, but that was not my intent to guide you to the probiotics world. My intent was to say, hey, there are nutrients that we give to increase the bifidobacteria, like vitamin C increases bifidobacteria, vitamin D increases bifidobacteria, bovine immunoglobulins, the blood from the cow that's spun around, that clear stuff, increases bifidobacteria. That's what we showed, right? And there's other things, certain herbs increase the bifidobacteria. The idea of probiotics really started from bifidobacteria that was shown in newborns, that was shown to decrease with old people, right? But what we noticed with the probiotics is, first of all, majority of probiotics out there say they have bifidobacteria, but don't even have bifidobacteria.
And if they do, it's not making it all the way to the large intestine, which is
Correct.
what we learned
And
from you in our last episode.
Yeah, the second problem is it gets broken down by the stomach acids, or even bigger problem, it gets broken down in the small bowel, which now causes SIBO. And now you've got patients complaining of gas, and I have that in my patients because, if my train of thought and my hypothesis in fixing bifidobacteria is really to see, do they have bifidobacteria to begin with? If they have some bifidobacteria, then I work on increasing that with vitamin C, vitamin D, bovine. If they don't have bifidobacteria, then I will give a probiotic. But here's the problem. The probiotic, you have to make sure the probiotic is quality. You have to make sure it goes to the colon. And when you do too much or when you add too much, you end up swapping that problem they came to see you with, which, for example, could be diarrhea, for now gas, bloating, and SIBO. And that's not a good thing, because I have that scenario of patients where I've done an implant and then they go get some probiotics, quality probiotics, but then they call me and they say, wow, that probiotic just threw me off completely of what you've done, because now I'm bloated, I'm gassy, and that starts a different problem, right?
So you really have to test it, is what you're saying. You have to know where you are.
You have to know where you are at baseline. And you can't, unfortunately, use the labs that are out there because they're not validated. So you have to, unfortunately, we use our lab because we validated it, because we've shown the data on fecal transplant, what a validation looks like, what stool transplant looks like. What are we doing when we change the microbiome and improve a disease like Crohn's or improve Alzheimer's? Even if in an N of 1, at the end of the day, it's still an N of 1 that demonstrates the microbiome, right? So you have to have a validated assay that kind of tells you this is what your level of bifidobacteria is. And then from there, you have to start treating and using the probiotic, but then being careful onto seeing whether the probiotic is increasing or decreasing. When you see a patient that had a 4% bifidobacteria, and then you give it probiotic, you give the patient probiotics, and you realize the 5% goes down to 0, we have a problem. I mean, that's the same thing as, taking antibiotics, right? Because now you're taking a product that was supposed to double your probiotic, but instead it drops it. That's a problem.
Dr. Sabine, this is amazing. And
Yes.
also, you're just one person, and you're an extraordinary person.
but
You're also only one person.
I'm definitely controversial, I'll tell you that much. But
Yeah,
but science is controversial. I mean,
Yeah.
like the moment we think, it's all clear cut is the moment we've lost science, in my opinion. We should be asking questions. And here's the other thing. It's okay to have an idea. It's okay to have a hypothesis. But then if your hypothesis is wrong, you have to come out with it and say, I was wrong, right? If you think about what I did with hydroxychloroquine, Z-Pak, vitamin C, D, and zinc, which was my patent, I spent the money on that patent. I believed that was the way out of the pandemic. I believed that was the way to kill the virus because I saw that hydroxychloroquine, Z-Pak killed the virus in the stools. But here's the problem. I also saw it killed the microbiome. So I discovered that it wasn't a one pill fits all, and that it wasn't, and I was, strong enough, or at least humble enough to say, you know what? This is not the way. This is not the way for everyone. I would not sleep at night if I gave hydroxy and Z-Pak to young kids and destroyed the microbiome, knowing what I know now, that it takes a long time to heal the microbiome after you've destroyed it.
It takes a long time. I destroyed
Yes.
mine growing up. I was given intravenous antibiotics for
Yes.
my osteomyelitis, and then I was on chronic ear infections due to what I think was a dairy intolerance. But I bring this up because most people are just navigating in the dark,
Right.
spending a ton of money on expensive
Yes.
probiotics, and they're trying to get to the root of their health. And we
Yes.
find that we're on the front lines, as you know, interfacing with the public, dealing with obesity.
Yes.
And we're dealing with addiction. And we know undeniably now there's a gut-brain axis.
100%.
And that depression, anxiety, and hopelessness, which is what we are dealing with this pandemic of obesity, that we're on the front lines fighting against. And most of them have really harmed their gut microbiome with the overconsumption of ultra-processed foods, meaning things that are in a box, bad oils, bad salts, genetically modified food organisms, herbicides, pesticides, fungicides, and excess.
Right.
And so what are those people supposed to do? Because there is only one Dr. Sabine. I wish there were 100 of you.
Yeah,
And I wish
so-
everyone could afford it, the hundreds of you.
No. So here's the problem, right? So the first thing we can do as a public is demand of our government to monitor the foods. Okay, so I think that's the number one. That's an easy, low-hanging fruit, right?
Mm-hmm.
Make sure what's on the label is really on the label, right? I think, there's a great movement right now to look at the foods, to remove the dyes, to remove the fluoride, the excess fluoride, etc. Let's take it to the next level, which is basically let's make sure that what's on the label is on the label. That's the first thing. The other thing is, making sure that there's no interference in research. Because here's the thing. I do this to educate other doctors so that they can follow, but they are not going to be educated by watching a podcast. I mean, the public's going to be educated by watching a podcast, but the doctors, the scientists are going to be educated by reading the data. So it's very important that this government or we, the people, stand up for, righteous research and no retraction of data and no interference in research. That's very important because until we stop the interference in research, until we stop the mislabeling the labels that mislead the consumers, we're never going to fix our microbiome.
I agree. And Kennedy's saying it's
the first-
propaganda. This research has been basically
Correct.
propaganda. And now hopefully he's going to put an end to it, but it's a long road.
Yeah, so that's one. Number 3 is we need to start having a microbiome assay, but here's the thing. We need to have research funds to pay for that validation of the assay. Because Sabine Hazan saying, you know, I have the best assay and the validation, that doesn't help anyone. It needs really the government to kind of say, yeah, you know what, Dr. Hazan's assay is valid, verified, and reproducible, and therefore now we can use it. Think about what the hemoglobin was. And I say this, when we were treating patients that were having blood loss, we were giving them, we could not treat them until we figured out what hemoglobin was.
Right.
You could empirically remove blood, you could empirically put blood in, but until you had, you know, very rigid guidelines that said hemoglobin of 7 and below needs a blood transfusion, hemoglobin of 7 and above doesn't. That's when we started, you know, these guidelines were created by non-interference of research and by scientists and doctors saying, being courageous to say, you know what, I'm not going to transfuse a guy at 8. Let's see what happens. And oh, the 8 goes up to 12. I'm glad I didn't do that. I'm gonna transfuse a guy with a hemoglobin of 6 because I don't feel comfortable with him having a heart attack, right? So when you look at how long it took for all this, it was years and years.
Decades, probably.
Decades. So from the moment you think of an idea, which is right now, think about what I've done. You said to me, you know, you've made Bifidobacteria famous, right? It wasn't my intent to make Bifidobacteria famous, but I saw Bifidobacteria as the hemoglobin of blood.
Right, like a common denominator.
Like a common denominator that kids with autism are lacking Bifidobacteria. Old people with Alzheimer's are lacking Bifidobacteria. Invasive cancer patients are lacking Bifidobacteria. Anxious patients, bipolar disorder patients.
How about obese patients?
Obese patients are missing. Diabetics are missing Bifidobacteria. So that common denominator of looking at these signals in these populations and saying, wait a minute, Bifidobacteria seems to be important, right? And then looking at, and that was me at the beginning of the pandemic. Why do the young not have so much COVID and why are the old dying? Why are the diabetics dying or the morbidly obese dying and not the skinny patients? What's going on there? And then why is a skinny person dying, but they have other comorbidities like autoimmune processes? We didn't look at the microbiome. So I was in a particular position where I had that data. I had the data before the pandemic. So when I saw the importance of Bifidobacteria in the exposed high risk, never got COVID, and high risk but got COVID multiple times, and I saw 0 Bifidobacteria in a high risk exposed and had COVID versus a lot of Bifidobacteria in the exposed never got COVID, I said, wow, again, Bifidobacteria is important. And then when I started treating, that's really when I started paying attention to
the stories that you have are just
I mean, like vitamin C increasing Bifidobacteria on me, right?
Even from an orange, or do you have to take like a certain dose?
No, I took a lot of vitamin C at the beginning of the pandemic.
Like 10 grams a day?
Yeah, I don't recommend it. Okay. I do not recommend it to anybody because, you know, it's obviously intense. there's also kidney function, etc. And so I don't recommend it, but this was something that I did myself as a guinea pig on the front line, as a patient.
Right.
So when you see that and you see, you know, what's happening with vitamin C and it increases Bifidobacteria, then you go on and you say, okay, I'm going to do 20 patients with vitamin C now. And I'm going to see what happens. And then you start seeing it increases Bifidobacteria. Ivermectin increases Bifidobacteria. But here's, again, where the interference with research was a problem. Because it didn't allow me to publish the data, which then the next data would be the long-term effect of ivermectin. And the long-term effect of ivermectin is that you need to keep using it, but then we don't know the long-term side effects. Like, could there be kidney problems? Could there be liver problems? Here's a drug that we're giving, that we're making the body be used to.
It must be so frustrating for you.
It's really frustrating because you cannot advance research if you don't publish. And you want the publication because you want others to validate your work. When I published that the lost microbes of COVID, one of the big things that was important for me was basically showcasing that data so other labs would do the same experiment. And when Japan and China and Italy reproduced the same data, I knew I was onto something.
That's amazing.
Right? Because then you're like, well, China doesn't know my work and Japan doesn't know my work, but here they are reproducing the same
that's
thing.
just the way it should be, right?
Yeah.
And that's the essence of the work, colonizing.
Yes.
And the way, the way you describe the colonization.
It starts as a paper. And then, listen, if that paper is real, it gets reproduced into 3, 4, 5 papers. If that paper is not real, then guess what? We need to figure out why it wasn't real, what were the problems, etc. But we can't stop it. Or what was it real maybe in certain population, maybe in the American population, not the Chinese. Who knows? But the reality is we can't interfere with research. And this is a new field that when you say, well, what do people do to increase their bifidobacteria? It really is a loaded question because everybody's different. You cannot watch everything that the patient's doing. So, for example, I may give him a protocol, let's say the Sabine Hazan protocol to increase bifidobacteria, but then you find out, well, they're doing some other products, right, that I didn't know about and all I can see is the bifidobacteria didn't go up before and after. So that's how you kind of monitor.
What can prevent bifidobacteria from going up?
So many things. I mean, glyphosates,
Sugar?
The sugar, sugar from honey should not, right? Because it's a pure sugar. But, even the sugar that we're eating now, the white sugar, how is that processed, right? I mean, how do they keep the sugar cane clean to get into your kitchen table? What is the process of, remember, all these products are processed to keep them longer.
Right.
So in our, attempt to make things last longer over the counter, to sell it, we've killed the product.
Right. Yeah. The endosperm is removed from the flowers.
That's it. So
yeah. So you're saying that fresh homemade things.
Fresh homemade, but how many people do you think are going to have access to that fresh homemade?
I mean, I think everyone has access, not everyone, but the majority of the population has access to a kitchen and they have access to a grocery store. But what they don't have access to are the skills that are required to just cook regular food like our mothers and grandmothers did. Most of the kids Penelope's age didn't have parents that taught them.
Right.
Schools, now home economics is considered sexist.
Right.
And so the doctors don't have any education in nutrition or very few doctors have it.
Or the things we were talking about, like walking in your garden, right? How do you have all these beautiful avocados and all these beautiful artichokes? You're using a specific fertilizer that you've tested that is a great fertilizer for growing your fruits and vegetables, and you're showing the results in your health, in your fruits and vegetables.
It's like basically fermented fish.
Yeah, so
algae.
Yeah. So, and actually, that product is a fertilizer that gives you the beautiful fruits and vegetables, right? So how many people are actually know this? So when you talk about how do we increase bifidobacteria, how many people know how to grow their plants properly?
Yeah,
and
like
their
we also
fruits
use worm
properly?
castings. We use like the charcoal. Like there's different ways to build the soil.
There's different ways to build the soil. Exactly. So to the farmer, when COVID hit, the farmers they're in tune with all that. They know that if your soil is not, if you're not picking up the soil and see 5 worms, your soil is not healthy. Because you need to have worms part of the soil, right? I mean, that's fertilization, the ability to fertilize is exactly that, right? To have worms, to have microbes. So they know that if my soil doesn't have worms, it's not a healthy soil. How many people actually know that, right?
It's a lost knowledge now.
Yeah,
and the grandmothers just got put into the homes. Well, and they're not in the household.
And so if you don't know these tricks in a way, how are you going to rebuild your microbiome? So that's why in a way it's a loaded question, because you could say, well, fresh fruits and vegetables, but which farm? Which farm are you testing? Are they using regenerative farming methods?
Yeah, are they, is their neighbor spraying?
Exactly.
Are they nutrient
Is there
dense?
a spray in the sky? You know,
How old are the trees?
yeah. So I could say, well, you know, eat fish and that's your protein. But here's the thing. I give this example. I was in the middle of nowhere, Idaho, trout fishing because I'm a huge fisherman. And right there in the middle of nowhere, completely beautiful, you know, lake, there's a guy spraying with a hazmat suit. So you can already imagine he's spraying, all the pesticides are going into the soil, into the river. Now my fish that I'm thinking is this amazing, you know, protein that I just caught randomly in the middle of nowhere, no exposure to pesticides. Well, wrong. There's exposure to pesticides. So, you know, if we don't stop these practices, you know, if we don't stop the pollution that attacks our rivers, that attacks our soil,
the bees,
and kills the bees and kills the worms in the planet, forget it. It doesn't matter.
Game over.
It doesn't matter whether you're spending $1 million to see Dr. Hazan to refloralize your gut. At the end of the day, you're refloralizing your gut, but you're going back to your environment. That is going to eventually kill it. And now you're going to say, well, you know, I did fecal transplant. It was a great donor. It lasted 2 months. Why? Because you went back to the environment. So it's not that easy. And there's so much work that needs to be done to get to that level. Think about what we've done with autism, right? So there's a whole big push of finding answers for autism, right? And here's the problem with autism. It's not a one answer.
No, it's a myriad of answers.
It's really risk factors. What are the risk factors that puts my kid at risk for autism? And the risk factors could be you gave your kid antibiotics. Could be mom was drinking a lot of alcohol during pregnancy. Could be mom was stressed during pregnancy. Could be maybe something in the vaccine, right? But you can't talk about that because that starts hesitancy, that creates a narrative change. But we have to talk about that. We have to look at all the risk factors so we could say, okay, antibiotics on their own is not going to create autism, because we've seen kids that took antibiotics and didn't get autism. Vaccines on their own are not going to create autism, because we've seen kids that were vaccinated and are fine and never got autism. However, what are the cumulative risk factors?
Yes, and using the information that you do have correctly to create breakthroughs. Because we've seen, Penelope went to school with a couple of autistic kids, severely autistic kids, nonverbal, and aggressive, and we saw some turn around.
Yes.
And it was amazing. But the parents were on it. They were detoxing.
Yes.
They had the personal trainer coming. They had the chef who knew what food to serve.
Yes.
They had the money for the antibiotics. They did the IV vitamins and supplements. I mean, they were like really hardcore.
And a lot of these parents, got lucky in a way, because now that I have the technology to kind of look at the microbiome of kids with autism, I could say, okay, this was not a treatment plan that I would have used on all kids, because we now have the technology that can say, okay, well, these kids have these microbes. These kids have too much fungus. Yes, an antifungal is going to be great for that kid. But for the parent that basically just gave an antifungal and their kid improved, they got lucky, because they went with a gut feeling, I guess, that this was a fungal problem, gave the antifungal, and the kid improved. But how many kids follow that kid and are not improving?
Right. Yeah.
And so when you look at that and you say, okay, well, we have a kid that's not improving with antifungal and a kid that's improving with antifungal. What's going on here? You have to look at the microbiome. That's the time where you look at the microbiome and you say, oh, well, this kid had fungus in his microbiome. Therefore, the antifungal was the right solution. This kid has a bacteria that's secreting a toxin, and that's not the answer. That kid. So, for example, we see a lot of kids that have Clostridium difficile. So those kids, believe it or not, fecal transplant might be the best option for them because we've shown with C. diff that fecal transplant helps C. diff. So now let's say a kid has a virus, right? That's a whole different ballgame, right?
Right.
And how do you come to that realization with autism? You have to almost look at the population of autism and say, okay, well, this kid with autism has this microbiome, but then his family has this microbiome, which is different than all the other kids with autism. So you really have to do calculated research.
Yes.
You have to be a detective. So again, if I can't publish my data, it's not going to help the next guy who
No.
believes that, I was listening to Judy Mikovich to an interview, and she believes in Suramin, right? But here's the thing again with Suramin. Maybe it helped a couple patients that she had the privilege of taking care of. Maybe she told them to use Suramin and it worked. Maybe because they had a microbiome that was specific to Suramin working, because how many kids have used that and are still autistic? So when we think about it's never a one pill solution. It's never, a one causation, what microbe causation. It's multifactorial. It's multiple microbes in multiple people. So it's not that
Are
straightforward.
they classifying autism as a chronic disease, or is it still considered more of a rare disease?
Well, it depends who you're reading, but I
Yeah.
think if you even talk about autism now, it's basically taboo. Thank God, like Robert Kennedy actually brought it up and is
Yeah.
talking and bringing up the fact that it is a pandemic. We have to pay attention.
Absolutely. And obesity is clearly leading the way
Yes.
in childhood obesity specifically.
Yes.
And I'm very concerned about the solutions that are presenting themselves. Penelope, I was a fat kid.
Yes.
And I was the only fat kid in my school with a nickname of Fatso. But today, everybody is not everywhere.
And instead of finding the solution, we've normalized it and said
Right.
it's okay. But at the end of the day, when you have a person that's 880 pounds, which I have one of those patients, no, we need to find answers for this guy. The poor guy is at home, mobilized. We have to find answers for this person.
What do you suspect is at the root, at a microbiome
I think it's loss of microbes. So we did an animal study where we basically gave animals some soy, and then we noticed that the microbiome changed with the soy.
You think soy is bad, dangerous?
I'm not sure if soy is dangerous, but definitely in those animals it changed their microbiome, and then they became obese. So, and by the way, the paper's on ProgenaBiome.com if
Excellent.
anybody's interested.
And I just want to clarify for the audience that there's soy oil in most salad dressings.
Yes.
In the salad dressing aisle at the grocery store. There's soy oil in many
Yes.
of the prepared foods
Yes.
at Trader Joe's. Not to diss Trader Joe's at all, but I mean, you have to really read your labels.
have to read.
There's soy oil in a lot of like the grape
Yes.
leaves, canned foods. The soy oil is nut milk. Soy oil. Soy oil
Yes.
is very cheap. It has a very long shelf life. And if you're not reading your labels, folks, you've really got to start reading your labels. So soy is in a lot more things than you realize. Soy lecithin.
Yeah, I'm not a fan of soy, period. I don't think it's good for the microbiome, period. I think you're right. We have an epidemic of obesity, not only around America, but around the world. I call it globalization, globesity. With globalization comes globesity. And if you look at islands in Kiribati, for example, where the population used to be super skinny and eating fish and vegetables and fishing, hunting. Now they're eating chips and soda, and they're morbidly obese, and the lifespan is about 50 years old. So I think we have a problem. We've altered our microbiome. We've altered the foods. We've altered the environment, the climate. Now, when we talk about climate, is it a climate problem per se, or is it a microbiome problem?
Both. I think they're interrelated.
Well, when you look
if it's
at
changing the soil, if it's changing the nutrient
it's changing.
density.
And when you look at loss of bifidobacteria, and when you look at bifidobacteria decomposing plastic, you have to ask, is it a loss of bifidobacteria that allows the accumulation of plastics
That is
in the planet.
interesting. That's
right?
really
and in your
interesting.
guts, right? So we're looking at that right now, actually.
Because
And I
plastics,
can-
we can't avoid plastic.
Yeah, and I can like leak the data a little bit, but we're looking at the amount of microplastics in someone's gut stools versus loss of bifidobacteria, and so you're going to find that people. And that's my hypothesis anyways, that people with loss of bifidobacteria are not decomposing the plastics. So
Are there other more
Do we
effective
have a-
ways to decompose plastic, like cistus tea or other
I mean,
things?
that all needs to be studied in my opinion, but I think we need to look at that, right? So, the planet was doing fine hundreds of years ago, and now we're having this, extraordinary speed in destruction and changes. Not only in changes in the disease process, increased chronic disease, increased cancer, but also, destruction of animals, loss of how many bees are getting killed now, it's incredible.
It's grave.
So what we can do as adults, as humans, is really to educate ourselves to go back to the farming, to go back to, what you did with having beehives in your backyard, right?
Thanks to you. You inspired me.
Yeah, it was such a simple thing as,
Yeah.
why not have a beehive?
Oh, I didn't tell you, but we actually had them. So we were
Nice.
looking around the property, and there was a huge hive that was underneath a piece of wood, and so they got
Immobilized.
Yeah, it was a
Wow,
beautiful dance
that's
to
a
watch.
Beautiful.
Yeah, so it was really exciting and exceptional.
Well, because you're kind of nowhere here. Like, it's beautiful.
yeah, we're in the wild
I
out here.
love that.
But-
that's what I love about Malibu, by the way.
That's why it's
There's
so.
so many areas like that are just so out there
Yeah.
and they're so remote.
Yeah, we don't feel like we're in the city.
No,
at
I
all.
know. I love it.
But it's almost embarrassingly simple, is what I'm hearing you say.
Yes.
And that, I think, is the biggest shocker. It's like, how could this big problem be so simple where it comes to getting outside in the sunshine, being barefoot on the soil,
100%.
eating fruit from your local farmers?
Growing your food even.
Yeah, you-
and I mean, there's so many opportunities now to grow foods.
Even in your own kitchen. Yeah, on your windowsill.
absolutely.
Yeah,
I think we just need to get rid of these devices, cell phones, and just put them away in a closet and go and plant your feet on the soil and get energized and get back with the planet, get back one-on-one when you're gardening. That's my health, that's my balance.
Wow. So, I mean, I just really want to emphasize and not fast forward here because, we're talking to Dr. Sabine Hazan. She is an expert, and you see how many hundreds of patients, thousands of patients she's seen, hundreds of papers that she's written, maybe more than maybe thousands of papers, the deep research you've been in, the brilliant brain that you have, all the things that you've studied and seen, decades of research.
Yes, decades of clinical trials.
Yes. And so I really want to reemphasize the solution is right within reach. It is not expensive. It is not fancy. It is not complicated.
When you look at products like humic acid, for example, right? And there's going to be some data looking at humic acid in some conditions. We're going to start working with the physician that's behind that. When you look, where is that coming from? The soil, right? When you look at, bacteria that's as old as the planet, where are they coming from? That are resilient. Where are they coming from? Deep in the soil. So I think we have in the planet everything we needed to survive, and within our bodies now we're starting to look at, platelet-rich plasma. Our own platelets have the ability to decrease inflammation from our bodies, right? So we are given all these things around us in the planet, the sun, the energy, the plants, the soil, oxygen. We're given all that for one purpose. We need to start utilizing it better to unite, to decrease the suffering, to decrease the hate, to decrease the pain. But, unfortunately, everything is a business, and everybody wants their thing to be the business. You can't. At some point, you got to say, okay, well, maybe this product is good for this population. And that's okay. That's a business enough. It doesn't have to be the whole planet
Right.
using that one product,
Right.
right? When propaganda hits, because it's selling a product. And at the end of the day, we still need to maintain our freedom of choice. We still need to maintain our innovations, our ability to innovate.
Yeah.
And we still need to maintain our relationship with each other, but also within the planet, to do no harm to the planet, to do no harm to other individuals, to other humans. That's how I like to live my life anyways.
Last time we talked about Ozempic.
Oh, yeah.
And I was like, do you have any updates on Ozempic? Are you seeing any patients with Ozempic? Are you seeing any microbiome changes yet?
We're definitely seeing microbiome changes. Nothing that I can discuss yet, but we are seeing it. But we need more patients. So anybody that's embarking on Ozempic, not that we're judging, this is your choice, your risk, your life. Give us a baseline and then a follow-up to look at what it's doing. Because
So
I
we're
think that
asking you to reach out. We'll have the link in the description. If you are on, can they be on any weight loss medication, Zepbound, Wegovy, or do you want Ozempic specific?
Ozempic, they could be on any weight loss. We're good with
A weight
that.
loss medication.
We don't want to target Ozempic. Why Ozempic?
Right. So pill form injection, like if you were on this, we are studying the impact on the gut microbiome.
Yes.
It's really incredible that you're doing
And
this.
it could be a beneficial impact that people
Right.
need to know as well. So
Exactly. So we have hypotheses; those are not proven out
Yes,
yet. But please help us. Help us by donating your stool.
yes, tools, also donating funds, that would be helpful. The Microbiome Research Foundation is what we created to support this. That's basically.
Because we want you to know the truth. We're curious.
And here's the thing. We're not stopping a product from coming to market by knowing the truth. You just now can make a better informed consent.
Absolutely.
You're not going to stop people that have benefited and have lost tremendous amount of weight on Ozempic and tell them, no, it's too risky. They know the risk. When Botox came around and women were using it on their faces to remove wrinkles, they knew the risk. They knew it was a toxin that we were putting on that they were putting on their faces. But guess what? At the end of the day, it's important to know the risk factors so you can make an informed consent.
Absolutely. Accutane.
Do I want it or do I not want it?
Yeah, I was on Accutane when I was, I guess, 18 or 19, and I had to get testing my blood every few weeks.
100%.
So the same thing. Like if you're on Ozempic, maybe there needs to be better regulations about how much exercise you're doing, what kind of diet, how you're resolving the basic issues that got you in the situation in the first place. Because that's one of the things I see as a larger societal context in this conversation. When do we forget that our bodies heal themselves naturally? When did we forget that? When did we think that the solution outside of ourselves is the answer? Because that's not the real long-term answer. And I'm sure you see this with your fecal implants, is that you have to actually take care of yourself in a better way in order for your work to be successful long-term.
If I give a patient a fecal transplant and I give him a new microbiome and that person doesn't take care of themselves, it's wasted. It's wasted. And in
Tell
fact,
us the tenets to take care of yourself.
And here's the thing. I'm very selective of who I do procedures on and who do I embark my time, because at the end of the day, it's a lot of time, hand holding, you're doing a procedure for a certain condition, and you have to involve the FDA in that condition. So you're doing a lot of legwork and a lot of paperwork that is not necessarily reimbursed. So if I'm going on this path with the patient, I want to make sure the patient is following everything I'm doing. Like the two twins that I basically took on that were nonverbal. I took them on in July of 24. The mom flew in from Tennessee to see me and with her twins, and she begged me to take care of her kids. But I knew this mom, like I had a relationship with her in my office, seeing her, talking to her, that, patient-doctor relationship. And I realized this mom is going to do everything that I tell her to do. And vice versa. She said to me, because I said to her after we've accomplished, having the kids speaking, the kids went from nonverbal to fully verbal now. And she said to me, I said, well, congratulations for following the protocol and succeeding in this. And she goes, well, I trusted you because I came to your clinic and I saw everything you're doing to do things right. She saw my lab. She saw the machines we have. This is a multi-million-dollar lab that we basically created to help bring products to market that help the microbiome, to help us understand the microbiome, so that if you do mess up your microbiome with product ABC, we potentially could know in the future how to restore that damage from product ABC.
Are there certain pillars to the lifestyle medicine protocol that you have your patients follow?
Well, one of the big pillar is stress. If highly, stressed executives that are basically having a lifestyle where they're flying every week,
Alcohol consumption,
drugs,
not
all that.
sleeping well.
Yeah. So if they're not going to change their lifestyle, it's going to be very difficult for me to treat them, because the problem is whatever I give them. I'll give you an example. I had a patient that came in with, needed fecal transplant, and he flew in from Puerto Rico on his private jet in Beverly Hills, but within 2 hours was back on his private jet, flying back. He didn't even leave it to implant. He was already on the go. So it's hard for that person. You have to think you're planting, you're gardening. Imagine I'm planting seeds, but then there's a tornado that goes on my dirt and my seeds are flying all over the place. There's never going to be implantation. Mm-hmm. So you got to kind of, so one of the big things that I insist on is that, decreasing that stress level, that high energy, and in some people, they have the microbiome that gives them that extra energy, that they can do all that, they can multitask. But when you're implanting someone that's never had those microbes, it's very difficult for those microbes to start becoming at this high level of function when you're still trying to grow microbes you've never really seen. So
most people aren't going to correlate necessarily that stress is going to affect the gut microbiome. Can you describe to us, for a layman, non-scientist, what that correlation is? Does it revolve around cortisol, the stress hormone? Is it about tissue being tense? I mean, what is it exactly?
I mean, I think the best way to explain it is imagine a bottle of water and you're shaking it constantly and you're seeing all these bubbles, and then the water bottle is going to explode, right? So if your life is that level of high stress, of constantly shaking things up, you're never going to reach, ability to implant.
So stillness is required in the tissue.
Calmness, meditation, yoga, harmony.
Cellular resonance, like that.
Yeah, lack of, important music, good music. You ever go to a concert and the sound is so awful that it like resonates in your body and you're just uptight and tense and you can't sleep that night? Music frequency affects the microbiome, and we're going to show that in the future. Light affects the microbiome. Is there certain light that basically calms you down? Lenses, when you're looking at lenses, right? Mm-hmm. Is there a lens reflection of a light or a color that is more soothing than another? There's so many things.
Korokov out of Russia has some diagnostic tools that I think Joe Dispenza is using that's showing this kind of resonance. It almost looks like an EKG.
We're so far on all that because right now this is all like gut feeling, and yes, that could be the way, but we need to scientifically show it. Mm-hmm. And we need to convince the physicians that are treating their patients that there's something to this science, right?
And you said there's a business model lacking. So the business model for doctors isn't really in the lifestyle medicine piece.
Correct.
They don't have much incentive to help the hand-holding to do the lifestyle interventions that are required to maintain and reverse health and reverse chronic disease.
I think there's a lot of doctors that are stepping into that world now.
Yeah, that are partnering with coaches usually.
And it's not something that insurances pay
Yet.
right? So that's the problem.
We'd like to see that change.
That would be amazing. But there needs to be, think about it, the insurance gives you 10 minutes with a physician, and the physician is following guidelines and staying in the guidelines so that he doesn't have to, lose his license or get sued.
Right.
So that's the biggest problem in medicine right now.
It is. It's a huge problem. 10 minutes is not nearly enough to reverse chronic disease.
I think medicine has a role for, delivery of babies, treating a pneumonia, surgery, appendix, trauma.
Yeah.
I think medicine, of the primary care needs to step it up a bit in that they need to not just give the cholesterol pills, ideally have a discussion with their patients and being that advocate of health to say, look, you can use an app and monitor whatever calories you're eating, and you can exercise, and I'm going to make you do this before I write the prescription for the medication.
That I love.
Because here's the thing, I'm a gastroenterologist, right? It's much easier for me to write a prescription for omeprazole or Prilosec or antacid for a patient than to tell them lose weight, drop the coffee, stop the mint, stop the alcohol, stop the fatty food, elevate your bed. It's much easier for me to write the prescription, right? And it's within the guidelines, etc. But here's the problem. That prescription is going to run me a problem with maybe my patients are going to get osteoporosis early. Maybe my patients are going to develop C. diff because now they've, killed they've alkalinized their stomach in a way and allowed microbes to go in that shouldn't have gone in, that the stomach acid was needed for, right? So a simple thing like, so I used to have patients that were, 300 pounds would show up in my clinic, and they would need a lot more Prilosec than the normal, like 80 milligrams twice a day, because they're overweight. They're 300 pounds. And I would say, no, I want you to lose weight, and then you come back to me with 10-pound weight loss, and then we'll consider it. But here's the thing. If you don't do that and you keep writing the meds, you never fix the problem.
Right.
And,
I love your heart.
And I have a problem with, giving a pill to allow the person to eat a steak. Change your diet. Like you want to eat the steak tonight, maybe what you do is tomorrow you're doing a cleansing or fasting or lemon juice for the day, because you kind of like have to balance that overindulgence with, of wine and alcohol, etc. Maybe calm down the gut the next day, right?
I think that's why doctors are so crazy about Ozempic and Ozempic-like drugs, because their hands have been tied in the past, and now they finally have a tool that can get results, because for them, it's just improbable that they're going to help their patients learn how to cook, exercise, and all that's out of pocket.
That's the key.
So they're paying now, if you're at dose within 3 months, they're going to pay in full for the weight loss medication.
Right.
But they'll only pay for usually 3 sessions with a nutritionist with a $25 copay only.
And are they paying for the gym? Should we start mandating people to go to the gym,
Yes.
I mean, I think there should be, incentives in the workplace.
Yes.
We have all these incentives where people should take like 10 minutes break, etc. But maybe, put a couple treadmills to get people to do that 10 minutes and go on the treadmill, or, make your work environment so that you can have an area where people can go walking.
Yes.
My staff, take breaks and they basically walk around the neighborhood because, it gets intense.
Yeah, I bet.
We're dealing with patients, etc. So you need to breathe the air. You need to go. Yeah. I think that's also in the policies, change the policies. I think if the government starts emphasizing healthier behavior, if we start showcasing on social media, because you're not going to start people from using these things, but if you start seeing people, influencers,
glorifying health, not
walking, walking, hiking, drinking the right stuff instead of constantly pushing products, I think I would love to see an influencer that's basically showing me how to do the bodybuilding that I need to do so that I can, get myself healthy.
Yeah.
Right?
I mean, the treadmill at the desk is a game changer. Penelope has gotten me into it, and I'm so excited about it these days. It's really different.
And I think businesses also can innovate
Yeah.
ways to, in a way, I was talking to my brother and we were in the car driving, and I said, wouldn't it be great if you could do abs as you're driving? You're kind of like doing this exercise.
That would be cool.
Where you're basically, tightening,
Yeah.
your
Well, I guess
abs.
you could, but you'd have to lift yourself off the chair.
You could tighten your belly
Yeah.
and close it, tighten, close,
Yeah.
etc. Or, there's so many things you could do, especially a person that's sitting in, I'm sure there's ways, maybe if Elon Musk is listening, ways for the car, especially as we're getting into these cars that are going to drive themselves, maybe there's something we could do in the car that's basically helping us not just be a vegetable, especially I think about
7 Series BMW has these hip raisers.
Oh.
So it does activate the spine. It's pretty exciting.
Good.
Yeah.
But also the poor truckers, they're driving this poor truck all day long and, they're gaining weight, they're eating horrible foods.
Yeah.
There's got to be something we can do. This is what my brain works, right? My brain is always find the solution that allows the trucker to drive, but also be healthy.
Yeah.
And I know there's a million things and a million products out there that we haven't even thought of.
I have a friend who has an obese son, and I gave her your number because they've tried everything. They've taken every blood test. They've done everything. I was like, but you haven't seen Dr. Sabine, so you got to call her. But, honestly, she's not alone. I was the exact same mom with Penelope at age 16, 320 pounds.
You knew why I was overweight.
Well, I was a little bit in denial. I was in denial. You were good at hiding things. You were good at stealing and begging and borrowing and whatnot. And so, I believe that there's something to be seen in the gut microbiome of her son.
Yes.
And you said this person was 600 pounds that's coming to you.
880 pounds. There's
Okay,
definitely something in the microbiome there. Lack of microbes.
So
we
is
tend
it
to think it's all about overgrowth of bad microbes? There's really lack of microbes. Lack of microbes that are absorbing vitamin B, lack of microbes that are that help absorb sugar or decompose sugar, calcium, so all that is very important.
So if somebody, now we know that children are predominantly eating 70% or more of their diet is ultra-processed food. Mm-hmm. And so we know ultra-processed food is packed full of dangerous chemicals and additives, preservatives, herbicides, fungicides, pesticides, genetically modified foods. And so all these things are compromising the gut microbes, is what I'm understanding. And therefore, in that compromised gut microbiome, they're not able to absorb the nutrients they need. And so the body's constantly starving. And that's why they have this endless hunger, even though they're eating enough for 4 people.
It's the same thing with diabetics, right? When you look at type 1 diabetes, and we're doing a study right now with bigger numbers, but even as a small signal, they're lacking Bifidobacteria. Is that why they're craving sugar? Because they're not absorbing, they're not breaking down the sugar with the bacteria, and therefore they're constantly needing sugar. And also because the sugar is not getting into the cells, the Krebs cycle is not working, the mitochondria is not working. So now the sugar is going all over the blood, and it's creating these kids that are super hyper and possibly aggressive. So it starts at the fact that we've lost the Bifidobacteria that basically got these kids to get into this position.
Prediabetes, and that's going to cause them, I believe it's also related to Alzheimer's disease and other.
Well, down the road,
down the road,
what we noticed loss of Bifidobacteria was actually linked with Alzheimer's and long haulers. Parkinson's, not so much. Parkinson's are missing other microbes.
I see.
So every disease has a signal of overgrowth of certain microbes and loss of other microbes. And it's really about reinstating the balance in the gut.
It's fascinating. And then maintaining it, sounds like, as well.
And maintaining it, but really, and where is that balance? And what is that balance for you? And is it different than me? And is it different than a person in Japan versus a person living in Japan, from Japan in America? Mm-hmm. So there's so many complexities in the microbiome that gets us to this answer. But the first thing that you have to start acknowledging is that we're killing microbes, which got these kids to begin with to have this condition. And once you stop the killing, you're seeing some light.
So what do you think about sucralose and aspartame?
Yeah, I mean, the body was not meant to tolerate the unnatural. So the moment you give the body an unnatural microbe that was made up in a lab, it's going to reject it, right? Because it doesn't recognize that microbe.
So it causes inflammation, autoimmune.
Yeah, but that's what inflammation is, right? It's the rejection of something that's non-natural. So you think about, where was the concept of vaccine to begin with? It was introducing microbes so the body recognizes those microbes so it doesn't develop a response, an autoimmune response. So now what I'm doing is I'm giving a little piece of the microbe so the body recognizes that microbe and doesn't create an autoimmune response. If you don't give that and you basically are exposing the body to, for example, you're sterile, you live in a sterile environment, you've killed, tons of microbes because you took antibiotics as a kid, and now you're going hiking and you get bit by a tick and you get Lyme disease, right? Why? Because your body has never been exposed to ticks. It's never recognized it. It's going to develop an inflammatory response. It's going to develop an autoimmune response. So, you look at a person that's in Zimbabwe, that's exposed to ticks, that touches a dung of an elephant and opens the dung and 1,000 ticks are flying or in there. And you say, how come that person doesn't have Lyme disease? Because that person it's part of its environment, it's part of its body. It recognizes that microbe, it recognizes the Borrelia, and therefore it doesn't see it as foreign, and therefore doesn't create an autoimmune process and doesn't create an inflammation process.
And I think a lot of people are taking these, aspartame, sucralose pumps at Starbucks. They think they're doing themselves a favor by drinking Diet Coke. They think that this is the best way.
It's not a natural
Cool Whip
sugar.
with cellulose.
Yeah, it's not a natural sugar. And you think of stevia. Stevia has been shown to, affect the microbiome. So
You mean adversely?
yes, correct.
So even stevia you grow in your garden?
Well,
It's a
I don't
plant.
know, but I've seen the data on stevias, so I don't know which.
So all sweeteners are off the table. Stevia, sucralose, aspartame.
Here's the thing:
monk
is
fruit, allulose.
how do they process it? How do they manipulate it? Is it in the manipulation? Meaning, is the plant safe enough for my gut? But then once it goes into the factory and processed, now it's no longer safe.
So the leaf might be safe that I grow in my garden.
Correct.
But and the honey that I collect from my bees and maybe the
but
maple
then
syrup.
if it gets processed, if it gets put in a machine that is where the pipes are full of copper, and now you're introducing that herb with the copper of the pipes,
Completely changes it.
Or it changes it, so
Yeah.
it's a different molecule at this point, right?
What? So when I was little, I was in these, what do you call them, specialized schools?
Yeah, you were in a school for language-based learning differences. So like you're highly creative, but not so great in reading and math.
Okay, and they diagnosed everyone with ADHD.
Yes,
And they give
that's-
them all these medications.
yes.
And I'm like, what is the medication doing to these children? Because I remember I was the only one that wasn't on medication.
Yeah, so if you look at patients with anxiety, okay, and because ADHD, anxiety, similar pattern in the microbiome anyways. So if you look at patients with anxiety, and now I'm taking my anxious patient and I see a signature microbiome. Some microbes are overgrown, some microbes are low. And what I'm going to do is I'm basically going to give that patient a drug. That drug is blunting here the anxiety, right? But it doesn't fix the microbiome. So you still have, in fact, which is kind of funny because I see a lot of patients on anxiolytics and I'll say, wow, you have a signature microbiome for anxiety. And they'll say to me, well, doctor, it's because, but I feel great now because I'm on these drugs. Well, the drugs are great because they're working up here. they're not working at the gut level. So the anxiety problem is still there.
Do you think people who have ADHD don't have ADHD and they actually just have anxiety?
I think people with ADHD are lacking microbes. That's what I think.
And the medication doesn't help at all.
I think it probably cuts down the symptoms, but I don't think it fixes
The root.
Fixes the root of the problem, which is the business model of most drugs, by the way. You look at a drug like a biologic, okay, for Crohn's disease. Well, it's a great product to stop Crohn's disease, to decrease inflammation, but you have to keep taking it on a monthly basis.
For the rest of your life.
For the rest of your life. So basically, you're not fixing the problem, you're just suppressing the inflammation.
So do you
which
think-
is what we're doing. We're really suppressing the inflammation and the symptoms, but we're not fixing the problem. And the problem is find the reason why this happened to begin with. And think about Crohn's disease, right? There used to be a time where we would do a whole workup on patients with Crohn's disease. You know, is it tuberculosis? Is it, a parasite, right, that's causing Crohn's disease? Is it medications that they're taking? And now we've kind of stepped away from that. We don't even look. We're just, okay, well, patient's having rectal bleed, colonoscopy, let's do some biopsies. Yes, this is Crohn's disease. Let's put them on a biologic. So what are we doing? We're basically
Kicking the can down the road.
We're not fixing the problem that stops these people from having Crohn's to begin with. We're basically putting them on medications. Here's the problem with the medication is that now the kid is being reminded that he has Crohn's disease every single month.
So we have to identify.
So now the brain, what does that do to your mental status? What does that do to your confidence? That you have to go to the doctor once a month. What does that do to your freedom? To your freedom to go travel? Let's say you want to go to India. Well, you can't because you have your doctor's appointment on that Monday. So you can't be free to explore the world, to do whatever you want. So I think we're doing a disfavor. And with that, mental health, problems, right? Because now that kid is depressed, even though you may look at this kid and think, oh, this kid is doing great. No, there's a psychological behavior. There's something that happens to these kids when they are taking medications that psychologically it affects them and it depresses them. And also that kid's thinking, well, am I going to get married? Am I going to have other kids? What if my kids have the same condition? So that stops kid from living a full life.
Yeah.
So I think we're doing, we need to, again, biologics were great and are great for the moment in time where we need to decrease the suffering fast in these kids and stop the bleeding. But the moment that we have something else that could be a solution that fixes the problem once and for all, we need to start looking at that.
I agree.
We need to start looking at that.
And I feel like your field is so new in the way you're approaching it.
Yeah, so my field has got to step out of endoscopy, colonoscopy, guidelines, biologics, etc., and start thinking of all disease begins in the gut, and we need to start looking at the microbiome, and we need to start innovating, and we need to start, thinking of how do we push the science, not that uses feces for solution, but that uses microbes in a consortium to help the disease process. That's what my field needs to step into to basically start advancing and bringing on new innovations. Because otherwise we're pretty stagnant and, well, let's just develop the next, biologic and the next biologic. I mean, how many trials have I done for pharma on biologics for Crohn's disease? I mean, at least, 24 trials. There's always a new biologic du jour that's coming, and we should be moving past that and saying, okay, well, let's go back to the chalkboard and let's see and think, what is the root cause of these problems? Why do we have an increase in Crohn's disease? What does the microbiome look like in patients with Crohn's disease.
And it's the wild, wild west, and there are trillions of microbes.
So we should embark on it.
I know.
Even more.
We need thousands.
Faster than we can,
envision, and you can only do so much.
But what a wonderful world, right? Where you can manipulate the microbiome of a kid that's nonverbal, and all of a sudden the kid's verbal. There is no better success story for me than that story when the mom called me and she goes, something's happening to my kids, Dr. Hazan. Something's happening. So, I live for these cases because they teach me something. The husband who came in with Alzheimer's, and I did fecal transplant using his wife's microbiome, taught me, first of all, what do I look at at Alzheimer's? What changed in the microbiome of that Alzheimer's patient, but also taught me that maybe Alzheimer's is not just a brain problem. Maybe Alzheimer's is a gut problem to begin with. All disease begins in the gut, and we got to start embarking, and I invite everyone. So when people come see me, it's not to see me as a physician, but it's really to embark with me on this research. And a lot of patients will say, I'm so excited to be part of your clinical trial, Dr. Hazan, because as I learn, they learn, right? So we're on the cutting edge of research. Remember, I'm the girl that was doing clinical trials for pharma for like almost 3 decades. So, that I've always liked the cutting edge. I've always liked being ahead of everybody and thinking, what's next, right? What's next? Now you have me thinking about this fish algae that I'm starting to think maybe there's some archaea in there and some resilient microbes that I need to look into it, right? So we need to see, what does everything do, and not just take the idea of someone that was brought on from generations ago that didn't have the technology. I'm thinking of something, for example, black seed oil, right? Mm-hmm. So people love
black seed all the time.
Yeah, but then the thing that you have to ask yourself, what does that do to the microbiome? Is that we know from, hundreds of years ago where they used to use it, that it possibly has a role as an antiviral, right? But what does that do to the bacteria? Does it also kill the bacteria? And therefore, well, it's great you've killed the virus, but then what about the bacteria? So what I'm saying is, just because something was passed on from generations to generations does not mean that thing is right.
Right. Mm-hmm.
Right? And so at some point, we've got to say, well, let's look at what black seed does to the microbiome. Let's look at what it does to the Bifidobacteria. Yeah. Even as a simple solution as in vitro, on a petri dish, and basically see what it does, right? Mm-hmm. So I think we need to advance science that way so that we can use those ingredients properly to say, well, I know that black seed does this to this bacteria, but I know that this herb does this to this bacteria. Let me combine them together.
It's my kind of conversation because you're using ancient tradition for modern technology for solutions that work and get to the root of the issue. Because unless and until you get to the root of the issue, you have continued suffering, pain, agony, and
100%
dysfunction. So after our last conversation, we got inspired to make our own yogurt.
Oh, good.
And so we got the book by Dr. William Davis to understand more about which bacteria, and we started to realize that. This is still the wild, wild west.
Yes.
And are these bacteria that were the L. reuteri, the Gasserai, like is it a good idea? Is it helpful? Could it be harmful? And honestly, I feel like we're just guessing.
Yeah, we are guessing. And the technology, unfortunately, is new. And there needs to be, everybody asks me about L. reuteri, and I have to be honest, I don't see it in too many patients. So is it because we've lost it, and therefore what was its role and what was its purpose, and therefore do we need it? So all these microbes, they become extinct after a while if we keep killing them. So I think it's important to know what they're doing and what they're feeding on and what's their purpose in humans, right? Because right now we are guessing. A lot of things we are guessing in that, I see studies all day long on this microbe for Parkinson's, this microbe for Alzheimer's. And then I'm looking at my database and I go, wow, that's not what I'm seeing. Then it's not validated, right? So we have to look at this carefully, and we have to be objective, and we have to be unbiased, and we cannot interfere with the data coming out, because somehow it's like the biggest kept secret. It's not. It needs to be a shared, but at the same time, it needs to be a shared secret, understanding that you have to protect it. So my job, my biggest role is really protecting the microbiome. My biggest job is preserving the microbiome, knowing what does the microbiome in the Amazon jungle look like versus China, versus Japan, versus America, so that in the event something changes, a big disaster occurs, we have a baseline of what it started, right? Before the pandemic, I had the baseline of my whole family's microbiome. It was huge because I felt, well, if something changes, then I know what changed during the period of COVID, so that I can try to mimic as much as possible my original microbiome.
That's incredible.
The pandemic. So I think, if anything, I encourage people to jump into that, to get a baseline, to see what they're looking at, and to embark with us, and to help us, if they have a product, to come and say, look, Dr. Hazan, we want to test the product on the microbiome. I'm the person that's going to be, you don't even have to pay me to say that a product is good, because I'm going to be the person that's going to tell you if the product is good, it goes to market, okay? But the research needs to be done at the end of the day. If the product is bad, the company needs to go back and say, why was it bad? Why did it kill the Bifidobacteria? I worked with a lady talking about yogurt who had a dairy-free yogurt. It was a great concept, had Bifidobacteria supposedly. So I tested her microbiome. She didn't have any, and had a history of cancer on top of that. And then I tested the yogurt, and the yogurt didn't have any Bifidobacteria. Now, here's a woman that bought into that whole yogurt, decided to make her own, trusted a factory from wherever to make it for her, and the factory scammed her and never put some Bifidobacteria in there. So, she had to change formula. She had to change manufacturer of who makes it, because she realized, hey, it's not helping me, and it's not going to help the next person. So therefore, time to change the formula.
Amazing story. I mean, so we realized after you said 98% of the probiotics don't make it all the way to the large intestine.
Correct.
Will not inoculate your large intestine with beneficial
Correct.
bacteria, and you don't know what you're doing, so it could be actually more harmful than helpful.
Correct.
So that's why we decided to make the yogurt. And so, what would you inoculate yogurt with, or is it impossible to make a generalized suggestion based on all the things you know?
It's kind of right now at the way, and I try not to, guide people, because really everything I do is research. I think it's, unless you're testing, and by the way, we are going to be testing, and we are going to come out with something that's going to allow everyone to test. That's a cheap solution.
Well, that's great
for
to know.
testing. Yeah, so my lab director is working on it, because I said, everybody's asking me what yogurt, what brand, and I don't want to be responsible for brand. We need to empower the public. So we're going to be having a test, hopefully by the end of the month. That's going to be a cheap test that's going to allow you to test your yogurt once and for all. And this way you can say, you're making yogurt. Did you inoculate it properly? Did you do it properly? And at least, from there you see whether it's helping you, whether, in general, if something is helping you, then and you're healthy, and you've not gotten COVID, because these days that's the marker if you haven't had a virus. If something is healthy, then great, keep doing that, right? Because if something is making you healthy, keep doing that. You feel good, your mental status is good, you're having, then keep doing that. If something is causing you gas, bloating, constipation, then stop it, because that tells you right away that something's wrong with what you're doing.
I appreciate you saying that. And I'm so excited about the test, by the way.
Yes, yes. It's going to be, I think it's much needed. I didn't want to be a consumer product at all, but I feel like we need to.
There's demand.
And there's demand and, time to embark. And we also need funding for research. So it pays for the research, hopefully the proceeds of that will pay for the research.
And if you're somebody out there that wants to support the research,
please.
There's going to be a link in the description so you can easily make a donation. Or is it a donation? Or
yeah, they can give a donation, or we have products that we have products of vitamins that we basically test for quality to make sure it does what it's supposed to do, and we make them in Florida. So all the proceeds of those products go to fund the research.
Amazing.
As well. So people that want to have a good vitamin, they can buy our biome boosters, and therefore support the research, but also have a quality vitamin that they can trust, that I take and that I give my kids and that I test on the microbiome. And you could rest assured that we have a control group in our lab that is constantly being tested because we're all taking different products to stay healthy.
And I don't know if people who are listening really fully understand the impact of that. Any supplement you're buying on the market is not regulated in this country.
No.
So you really have no idea what you're getting. And so to know that your vitamins, your supplements are going, the research is
We're
behind
testing.
it.
So
it's in front of it. It's around it.
Yes.
It's a
No,
circular
and
economy.
actually, let me tell you, I even tell the factory, I go, if I find something, because you never know, there could be copper in the pipes, like I said. They may not know they have a leak somewhere in their factory and that the product has, some copper in the products. So they need to know that I'm testing. They're fine with me testing because it gives them that second, they already test themselves. But with me testing, it's like that second level of confidence that it doesn't harm the microbiome. When you think about bovine immunoglobulins, which is one of the great products we have, it's blood from the cow. Are you testing that? Blood is dirty. So is there microbes in there that would harm me rather than benefit me?
And aren't most cows vaccinated?
Well, that's it. And that's the problem. So you got to make sure that there's no extra things in that bovine, right? So we test all that before, because what we saw with bovine immunoglobulins is that it increased the Bifidobacteria, decreased the Bacteroides, which was a key component that we saw with anxiety. So we saw people improving their anxiety symptoms and sleeping better at night with just the bovine. But here's the thing, if the bovine is contaminated, if it has something else in there, then I'm harming my patients more than I'm benefiting him, because as much as the product is clean, that cleanliness is what you want to do what it's supposed to do. So we do that work because ultimately why did I test the yogurts? Because one of my patients, one of my celebrity patients came to me with a $27 bottle of probiotics drink. It was a probiotic drink. And he goes, look, this is $27. It's got tons of Bifidobacteria, I'm sure. I go, yeah, let me test it. So while I was testing that $27 product, I decided to test other products, 26 products altogether. And that's how I discovered, first of all, that $27 bottle didn't have any Bifidobacteria. It was actually a lot of, sugar in it. It was just not a good product. And so how am I going to fix my patient who's one of those high, going from one movie to another? How am I going to fix that person who lives a super stressful life doing what he does if he's $27 drink is killing him, right? So you almost have to figure out all the stuff they're doing. So it takes meticulous work.
It really does.
To understand, well, what are you doing? I had a woman who's a designer in New York, and I put her on my protocol. She wasn't increasing. Come to find out, she was taking some product that was actually killing the Bifidobacteria. And once I stopped that product, then the BIF started going up.
So people who are on metformin, is that harming the?
We don't know yet.
We don't know yet.
That's
but you had said berberine is potentially
berberine could. It needs to be looked at.
What about Gynema? which is another
I
natural
did-
one.
All those products need to be looked at.
Okay.
And here's the thing, if somebody tells me, no, I don't need to, it shows the benefits in the publications, then I know right away there's something fishy with that product. Because why would you not want to showcase your product as benefiting the microbiome? Why would you not? I mean, like, I'm here, if your product is improving the microbiome, I'm going to be the first one to say, like bovine immunoglobulins, bovine IgG is good for the microbiome, you know, from what we saw with patients with IBS and in some people with Crohn's disease. So why wouldn't I say that? I published on it, right? Vitamin C benefits the Bifidobacteria. Why wouldn't I say that, right? And vitamin C is not a patent. Anybody can make good quality vitamin C, right? So, and that's why doctors that give vitamin C treatment do feel like they're doing something good.
Yeah. Okay. So if I'm understanding you correctly, you've had success in restoring brains and bodies with autism.
A bunch of patients.
Crohn's disease.
So autism, we had an N of 1 with fecal transplant, which kind of gave us an idea of what was going on there. And then what we're starting to do is really develop a protocol that just manipulates the microbiome. Crohn's disease, yes, there's multiple ways with Crohn's disease. Unfortunately, there is a population with Crohn's disease that they have to stay on biologics. But, you know, some patients with Crohn's disease actually are not Crohn's disease. It's an infectious process. Some people with Crohn's disease, it's a genetic process. Some people with Crohn's disease, you know, have a lack of diversity, and some people have lack of Bifidobacteria. On the most part, they all have lack of Bifidobacteria at the beginning. But, you know, if you zone in and you kind of say, okay, well, is it Crohn's disease from Mycobacteria paratuberculosis? Then let me fix the Mycobacteria paratuberculosis, then fix the microbiome. Is it Crohn's disease from Yersinia enterolytica, right, which is another microbe? Is it Crohn's disease from E. coli? Is it Crohn's disease because of lack of diversity? Is it Crohn's disease because of genetics? So all that
Plays
a role. And again, you cannot have a one causation factor. It's really, you know, multifactorial for different people. And so Crohn's disease, Alzheimer's, we have an N of 1, and now we're doing some work on finding a formula that can restore the gut for those patients with Alzheimer's.
Obesity?
Working with different products. Obesity, really, we've not really touched on it. I'm into the investigative phase of obesity and the microbiome, but we've not really focused on products yet.
And what about diabetes?
So diabetes, we're working with John Wellborn, who's a ex-NFL player who has a very big interest in type 1 diabetes. And so we're working together with a bunch of people to try to raise funds to develop, you know, to look at the microbiome of diabetic type 1. From what we saw so far on a few cases, we want to see it on a larger scale. And then from there, manipulate the microbiome and see if we can improve these kids. Certainly, we've seen improvement by manipulating the microbiome, by improving the Bifidobacteria, but it's not enough to get them off the insulin. So, you know, we need to understand that better. And my question then becomes with diabetics is it a pancreatic issue, a pancreatic microbiome issue, where maybe they have some parasites in there, maybe they've got an alteration, a dysbiosis of their pancreatic ducts at the pancreatic level that affects the production of insulin. So we're still far from answers on diabetes, but definitely, you know, promising. Cancer, you know, we're seeing certain cases here and there. You know, definitely you've heard the cases of Mel Gibson talking about his 3 friends with, I think it went with Joe Rogan, and he was talking about they got, you know, ivermectin, fenbendazole. And, you know, for those 3 cases, you know, there was success. You know, I know 2 of the patients, I know of 2 of those patients. So they were sick, and one of them I have the microbiome before and after. But I will tell you, it's not for everybody. So why is it, again, that some patients are improving with high dosages of mebendazole, ivermectin, etc., and some patients are not? And is there a role to chemo? Is there a role to radiation? Is there, is there a role to radiation and chemo with manipulation of the microbiome? So my own case of, I had a patient with metastatic mesothelioma. We did fecal transplant using her grandson, and we extended her life. She improved her appetite. She improved her hemoglobin, but it wasn't continuous. And again, it wasn't continuous because she went back to the environment. She went back to the stress. And the stress of even knowing that you have cancer, affects the gut, right? So cancer, is definitely, an interesting field for me to tap into, because we've shown that loss of Bifidobacteria is a problem in invasive cancer. And is it loss of Bifidobacteria because of the chemo, because of the radiation, because of the stress of having cancer? Because of something else they did that killed their Bifidobacteria, and maybe they had a microbe. I think, and I'm going to be bold and say this, I think there's going to be in a future where we're going to have, every cancer is going to have a microbe attached to it. Think about HPV, cervical cancer, H. pylori, gastric cancer, Burkitt's lymphoma, Epstein-Barr virus. So I think in the future there's going to be a link to a cancer and a microbe
that's lacking, that needs to be repopulated.
Well, lacking and also overgrown. So in other words, is the tumor growing because of a microbe that's in there that's allowing it to grow? And therefore suppression of that microbe would be first to kill off the tumor. Unfortunately, the methods that we have right now at killing the tumor is we kill off everything. Kind of like what we do with hydroxychloroquine, right? We kill off the virus, but then we kill the whole microbiome.
Yeah.
That's not necessarily a solution, because the problem is, well, you've killed the virus this time, but then what happens now? You've killed your microbiome and your Bifidobacteria, and now you're going to get another virus and another virus. And pretty soon you're susceptible to everything. Knowing what I know today, which is once you kill your microbiome, it takes years to recover.
That was my experience.
Of steady, protocol, knowing you're on the right path.
You're also a mother, and you're a daughter, and you're a sister.
Yes.
And so what advice can you give to the moms out there who themselves are obese and or have a child that's obese? And you have so much perspective on this, just from being in this world, but also your expertise as a physician.
I think it's hard as a mother with a child, because you have that, mothers and daughters have, an interesting relationship, right? The daughters are more likely to listen to their dads than to their moms, right? Because there's that relationship there. I think it depends on the child. There are children that are very mommy-daughter, and there are children that are more daddy-daughter, right? So if the child is more mommy-daughter, then just conversation with that child, and bringing in love, because that's a sensitive topic, right? Because if you say it, then it's, oh, you don't love me, and what do you mean?
You're
I'm
fat-phobic,
and I'm a
body
fat-phobic.
positivity is telling me that I'm great.
And I want to be positive, and I want to think of myself and love myself for who I am with my body, etc. And it's a tough, like even for me, like having gained weight during the pandemic, it's tough to be at that level. And regardless who says it to me, it really needs to come from you. It really needs to come from within to say, I'm not happy because I'm trying to exercise and I'm short of breath. I'm going up the stairs and I'm in pain, or I'm short of breath. I'm trying to fit into this dress that I really love this dress, but I can't fit into it. So I'm not happy. So it really needs to come from the person. And I think the first thing that I would say is, to have that my biggest approach in life is we come alone, we leave alone. So it's really not up to me to tell my girls, I made that mistake as a young parent, because nobody writes the book on parenting, right? You kind of like, it's all out there. You're thinking you're doing the right thing. I remember my oldest child, I was sterilizing every little bottle, and I was, super nervous about her falling, and I had all these things, and because I was a nervous mom, anxious that I'm holding on to this little baby, right? And then the second child, I trusted God more, and I think that's the thing that I would tell everybody is have faith. Have faith in God. When you have faith, you have less fear, and whether it's God or this energy of the planet, because you can't. If you say God, people are getting all crazy there too. We live in this world today where you can't even say your opinion. If you say, the color black, they're tagging you,
racist,
you're
yeah.
racist. And so, I would say, have faith that your kid is going to be fine. Do the best you can, and have them learn to be self-sufficient. Less dependent on you, self-sufficient in the dress code. Emphasize, one of the things I didn't do because I was so busy is I was not that role model for my girls because I was so busy. I was working, etc. If I could go back, and I said that to Jillian Michaels, I said, if I could go back, I would probably emphasize exercise and healthy living and gardening and being outdoors a lot more by taking my kids on a hike. So showcase by not saying, but by actually doing, by hiking with your daughter, by eating the right food, by yourself, because if mom is overweight and eating junk food, then the kid is going to eat junk food because mom's doing it, right? So it's like, well, why is it good for me and not for you, right? Why are you doing it for you and you want me to be a certain way, right? So I think set an example that your child wants to be like you. I think that's the one thing. It's difficult, and as a daughter, it's difficult for me to even, to teach my mom, right, on how to be. And I always say, Mom, you have to set the example. If you want me to do something, then do it yourself first, right? I mean, like, you have these expectations of me, but then why aren't you doing them for you? Because essentially what happens is we tend to live through our kids. And that's a mistake that we cannot do.
It's actually destructive.
Yes, you have to let them live their life. You have to have them figure it out. You have to be less holding on because you're fearful that they're going to fall. They're going to fall. You just pray that they land on a soft mattress and that they learn from the falling, right? Every time, I don't look at failures as failures. I look at them as, in a way, a learning lesson that gets you to be better, right? We're all here to learn something. So that's what I would say,
Be the example.
Be the example, and let them be themselves. Let them explore. Let them see the world. And the most important thing is give them love. I think, a child that is loved, that gets love, and however some parents are not really good at showing their love, so they'll send you on a trip. Well, that's the way that they're showing you their love. So, I think show love in any way that you can, but be present for them and listen to them and open communications and have that communication to say, well, why are you sneaking in, candies and the junk food
like
when
healthy. She was like rebelling against it.
Yeah. But you can kind of like, subliminally without saying, you could show also the data. Research is all about data,
I'm sure they would love that. But
for example,
I would have loved it if you would have made my Burger King order at home for me.
Well, then you would have figured it out.
No, I know.
But the other thing is showcase the problem, right? So like I have a kid that likes Coke, Coca-Cola, and I sent her a video that says, wow, they're using it to remove rust. Can be good if it's used as a cleaning product, right? But also I understand that Coca-Cola is designed to make these kids addictive.
Yeah.
Addicted to
foods in general.
and junk food and all that. They're addicted to the food that eventually is going to kill them.
Yeah.
So the microbiome gets used to certain foods, like it gets used to drugs, like it gets used to alcohol. You stop giving it those foods, eventually those microbes that were sustained on those foods are going to die. Mm-hmm. And then other microbes are going to grow. So it's whatever you want to give it. Mm-hmm. to make it a flourishable garden.
That's another question that I've been meaning to ask you, because you've been doing work with insulin, and you understand a little bit more about the pancreas and how it's happening as your studies are revealing themselves. But when we go to a ketogenic diet or even a carnivore diet, is it causing insulin resistance long term because of this adaptability that you just described?
Yeah, so it's I have these discussions with cancer patients tend to be on ketogenic diet, right? But the problem is, again, what is that doing to the bifidobacteria? We're coming out with that data, so I'm not going to say it right now.
Well, I'd love to reveal it.
That's going to be coming. That's going to be coming. What does a ketogenic diet do to the microbiome, to the bifidobacteria? What does the carnivore diet? Remember, carnivore
has fruit.
Has a lot of microbes, right? Like meat has a lot of microbes, right? Cows have a lot of microbes. Vice versa, vegetarian diet, herbs have a lot lot of microbes on them, right?
So I was just speaking specifically though about insulin resistance.
Yeah,
I'm noticing it. For a longer term, clients that have been doing these diets, they're no longer able to process carbohydrates.
Yeah, yes, because you've depleted the ability. So think about the patient that has been on different kind of processed gluten and now all of a sudden is gluten intolerant, right? And then when we do fecal transplant, we reverse that because we gave back that microbe that was helping with the gluten process. That's the thought process anyway of how it happens. I think all of it at the end is going to be loss of microbes and overgrowth and loss of balance. That's what we'll see, but we need to know up to what level do we do. Maybe we do the ketogenic up to this level till your microbes are at this level, and then you stop it so that you don't lose the ability to absorb or tolerate carbs.
Yeah, interesting. And are you also able to look at DNA integrity and longevity with the gut microbiome?
Longevity is something we're working on, yes.
Interesting.
Yes, we have samples of centenaries from the blue zones, and we have, people that are over 100 years old to look at what is it in their microbiome that allows them to still live.
That's exciting.
Wow.
Yeah.
I love that.
And it's not necessarily a microbe that's specific to the aging process. It's really the presence of microbes that should not be there. Presence of microbes that typically in a person that age should have disappeared and is still present. So it's fascinating.
Yeah, and the immune system perhaps as well as a global concept.
Yeah. So longevity is, we saw with COVID, the process of aging is this loss of bifidobacteria. So bifidobacteria definitely has a role again in longevity, but that's something that we're going to have to showcase in the future. Why is it that some people are retaining their bifidobacteria at a certain age and some people are not?
Well, I want to plant the seed, inoculate, so to say, the idea of a program that help the general public build their BIF. I don't know if it's even possible or probable, but I would love for everyone to feel empowered around their own health.
They can always contact ProgenaBiome. We give out, we have a diet, at least that's the low-hanging fruit, right? Where don't take these foods, don't take this, and take these foods that are benefiting. So at least this is the beginning to start seeing if that helps you, and then obviously the right nutraceuticals, the right vitamins, etc., to help guide you, without having to do the expensive without having to do the expensive microbiome testing and everything. But if you're in a level of, hey, I just want to improve myself, I will say, and I say this to all over, if you're healthy keep doing what you're doing. If you have longevity in your family and you're healthy and you've not changed anything, then keep doing what you're doing. Because I think our fears of disease can also impact the microbiome. So decrease the fear and try to do your best. I give these diets to my patients, and they always ask me, inevitably, I get like 5 phone calls on the diet after I give them the diet, and they say, well, why this, why that? And I always say, do your best. Because I don't expect anybody to follow my diet to a T. So
Thank you.
thank you. On this note, back to clinic. So it was great. Thank you so much for having me.
Oh, so great to have you. There's like never ending things I want to talk to you
Oh,
about.
yeah. Well, we could talk about so many things.
Hey, we noticed that 79.2% of you are not subscribed, which means you're watching our videos, you like the content, but you haven't made the commitment. So we would love it if you would subscribe. And if you want to join our Women's Accountability Group, don't forget to click the link in the description to join. We're only accepting amazing, awesome, and ready women. So please join if you're one of those. Don't forget to like, comment, share, and subscribe, and we will see you all the time.